FindMyDentist.com, and today I'm going to be answering the question, what is a root canal? A root canal is a procedure that a lot of patients fear, but in fact, according to the American Endodontist Association, over 15 million root canals were performed in the United States alone last year. A root canal is a procedure that can restore the function of the teeth while removing some infected areas of the pulp. In order to understand what actually happens when you have a root canal, I need to explain some fundamental dental anatomy. A tooth is made of a crown and a root, and the crown has 3 layers. The outermost layer, which patients see in the mouth, is called the enamel. Underneath the enamel is the dentin, which makes up most of the tooth, and underneath the dentin is the pulp, and the pulp has a pulp chamber in the crown, and depending on which tooth it is and how many roots there are pulp canals that go down into the roots. A root canal is necessary when the pulp canal and the pulp chamber become infected, and it's bad to have bacteria in that canal and in that cavity. So what you do is you need to go to a specialist called an endodontist. An endodontist will use a wide variety of assessments to determine whether or not a root canal is necessary. A lot of times they'll do electrical testing to see whether or not the tooth is sensitive to hot or cold or to pain stimuli. If it's not, that's usually a sign that a root canal is needed. Another thing they do is take radiographs. This is one really valuable way to assess whether or not a root canal is needed, because they can see whether or not an abscess has formed at the root tip and determine whether or not the ligaments surrounding the tooth have widened, which is also another clinical sign that a root canal is necessary. They'll also perform a head and neck exam to see if there are any swelling in the jaw, and that's also another invaluable tool to determining whether or not this type of therapy is recommended. Once you decide that a root canal is necessary for the pulp, you can accomplish this probably in 3 appointments, but sometimes 2. There's a series of steps that take place. What happens first is a small hole is drilled in the tooth. It's an access hole, and what dentists do is remove any infection that they find in this tooth. That involves removing most of the pulp. They have to measure the size of the pulp canals to accurately understand whether or not they have taken out all the infection. Once that's done, the tooth's isolated, and the patient is numb the entire time, so this is not a painful procedure while it's happening. Once the infected area is removed, the dentist will, oftentimes at the same appointment, clean out the tooth and seal it off. What they fill the tooth with is a substitute material. It's called gutta percha. It's also used in chewing gum. It's a soft material that will allow you to maintain the same shape of the tooth, and it's a really great material. It's cost effective, it's comfortable, and many times certain substances are added to it to sort of soothe the area around where the root canal has taken place. Once this is sealed off and the pulp canal is completely filled, the dentist will oftentimes place a temporary filling. A temporary filling will cover the access hole, and while this filling is placed, the dentist is often having a crown made up in a lab to cover the affected tooth so that it still has its original shape. Now, this crown can be made of metallic substances such as gold, or it can be made of porcelain. A lot of patients also choose porcelain fused to metal crowns. There's no right or wrong choice. It's entirely up to the patient. Once the patient chooses a crown material and the crown's been fabricated in the lab, the tooth is then crowned. The tooth is then at that point in its original condition. You can chew, you can drink, your jaw will not lose any bone because there's still a tooth structure in place, so your body sees that as still having a tooth, which is much better than having the tooth extracted when it's infected. The only difference is that this tooth will no longer be sensitive to heat or cold or pain stimuli. In order to prevent a root canal from being necessary after one is performed, you must have meticulous oral hygiene, and you must go for regular dental checkups. Other than that, a root canal is a very positive procedure with a good outlook for patients who have it. Thank you. I'm Lauren from FindMyDentist.com.